Chapter 4, Birth. In this chapter, we're going to be talking about the process of giving birth and some cultural differences as well. So the process of birth happens in three stages. The first stage is the longest, which lasts an average of 12 to 14 hours. In this stage, uterine contractions are 15 to 20 minutes apart and increase in frequency and intensity as the stage progresses. Each individual contraction lasts for about 1 minute. So you can see that here on this chart. We have stage 1, which is just basically where contractions start. And again, this is the longest stage. It can last on average from 12 to 14 hours, sometimes longer than that. Stage 2 begins when the baby's head moves through the cervix and birth canal and ends when the baby completely emerges. This stage typically lasts about 45 minutes to an hour, with contractions occurring every minute. And then the last stage, the third stage, is called afterbirth, and this involves the detachment and expelling of the placenta, umbilical cord, and other membranes from the uterus. So this is the quickest stage. Um, so again, stage 1 is typically when your contractions start. That's the longest stage. Stage 2 is when the baby actually starts to crown and ends. This stage 2 ends when the baby is completely out. Stage 3 is just the removing of the placenta and umbilical cord. So there are different settings you can give childbirth in. In the US, 98.5% of births occur in hospitals. That's typically if you've given birth or if you've never had that experience before, if you've seen it on TV, it typically always happens in a hospital in the US. Um, there has been a recent increase in giving home births. So essentially how it sounds, you give birth at home rather than in a hospital. This increase has been in the demographic of mostly non-Latino white women, especially those who are older and who are married. Um, in comparison, 35% of births in Holland occur at home. So you see on the screen here, 35% of all births in Holland occur at home, whereas here only 1.5% of births in the US occur at home. So there's a big difference there. In the US, pregnancy tends to be viewed as a medical problem, which can lead to unnecessary procedures. So rather than viewing pregnancy as something natural that women are built to do and can do safely at home, it's seen as a problem that needs to be hospitalized and have surgeons around to make sure nothing goes wrong. So the people who give birth are actually considered surgeons. So they're trained for surgery. They're trained to look for those for problems. So they may overreact in some cases, which leads to unnecessary procedures and can lead to damage to the fetus and the mother. In addition to different settings, there are different childbirth attendants. So in the US, it's common for the birth to be attended by the father and or birth coaches. Most non-Latino white women who have home births have a midwife attend the birth. Um, and this varies across cultures. In some cultures, men are excluded from the process completely, and the woman's relatives stay throughout the whole process. Um, so in different cultures, you're going to see different people attending the birth. But let's talk about midwives real quickly. So a midwife is a trained health practitioner who helps women during labor, delivery, and after birth. So compared to physicians, certified midwives generally spend more time with women during prenatal visits. They place more emphasis on counseling and education, and they provide more emotional support and are more likely to stay with the woman during the entire labor and delivery process. So remember back this to when I was talking about the different stages of birth and how whenever you start going into labor, you start having your contractions, that can be on average 12 to 14 hours. And if you're just in a hospital, the doctor is going to come in every now and then if something's wrong. Nurses will come in and out, but no one's staying with you full time throughout that whole process. Whereas if you have a midwife, they're there for you, so they would stay with you during that whole time and afterwards as well. The rate of midwife use in the U.S. is slowly increasing. The use of midwives has been linked to more positive outcomes for babies than those that are delivered by doctors. This is probably partly to do with the fact that midwives provide more than doctors do. So like I mentioned, they provide counseling and education. They help with prenatal care, and then they also provide emotional support as well. So there's another childbirth attendant that's called a doula. So a doula is a caregiver who provides continuous physical, emotional, and educational support for the mother before, during, and after childbirth. A doula is usually part of a birthing team. Doula-assisted mothers were 4 times less likely to have a low birth weight baby and 2 times less likely to experience birth complications. So a doula is very similar to a midwife. It's just that a doula wouldn't be able to deliver the baby by themselves. So if you want to have a hospital birth, you might have your doctor who's going to deliver the baby, and you might also have a doula. Whereas with a midwife, you could have a midwife and have a home birth or a birth at a birthing center, a water birth, those kinds of things. You don't need a doctor present if you have the midwife, but you couldn't do those with a doula. So they're similar. It's just a midwife is actually trained health practitioner who can help deliver the baby, whereas a doula just provides physical, emotional, and educational support. There is also a stat in your textbook that talks about how for Medicaid recipients, the odds of having a C-section were 41% lower for doula-supported births in the U.S. So again, you see a difference there when you have that extra support and education that women make different choices. A lot of times it can be scary if you've never given birth before, if you don't have prior experience. You just do whatever the doctor suggests and you don't know you have options. A lot of times if you have a C-section, it's harder for you with future children to have a natural birth. And doctors are afraid of that, so they just automatically recommend a C-section rather than trying to have a natural birth. There was a problem before too where um, hospitals were having outrageous amounts of C-sections, and you can schedule your C-section ahead of time, and their hospitals would get more money for that, and women liked that because they could plan their schedules around it. So they could pick a date and say, okay, this is the day I'm going to have it. So obviously, if you're working a lot, that's easy for you to then say, well, this is the day I know I'm going to have my C-section, so I can plan around that rather than waiting to go into labor. But C-sections can be really dangerous, so the hospitals have been trying to decrease that rate now. And I linked a video on Blackboard, the Lisa Ling series about giving birth. It gives really great info about all of this. So this brings us to talking about the different methods of childbirth. U.S. hospitals often allow the mother and her doctor a range of options regarding method of delivery. So some things to consider are first medication. So there are different medications that are used for different reasons during the birth process. You have medications that are used to relieve pain, and you have anesthesia, which can be used to block sensation during labor. So if you have anesthesia administered, usually it's from the waist down, so you don't feel anything. Um, you can have hormones given that stimulate contractions if you're not progressing fast enough. Um, so those are some different medications you might have during birth. Most of those, like that's up to you on if you want to take them or not. Some people prefer to have a completely natural childbirth without any drugs involved, and some people want to have all the drugs that they can. So that's up to the mother. Um, Different fetuses react differently to medication, so it's hard to determine what a proper dose is because some fetuses may react really strongly to a certain dose, whereas others don't react to it at all. So it's very dependent on each person and each fetus. So there's no really good way to know how much is too much. Anesthesia can actually be transmitted through the placenta to the fetus. So it can be dangerous, but it's hard to know what is safe for all women and all fetuses. And then we have the next bullet point, natural and prepared childbirth. Um, so these are just talking about different methods. So you have the Bradley method, which is focused on reducing pain by increasing education on birthing without medication and breathing and relaxation techniques. And the Bradley method usually involves husbands as coaches. And again, it focuses on learning relaxation techniques. So with this one, this is what I was talking about. Natural childbirth would be without medication. So you're learning how to reduce pain and focus by controlling your breathing, learning different relaxation techniques, having your husband or partner there as a coach. And this method also focuses on proper prenatal nutrition and exercise as well. And then the next one is prepared birth, which is also called the Lamaze method. This one includes a special breathing technique to control pushing in the final stages of labor. This is one you've probably heard of before as well, where you've seen probably like on TV where they do the breathing technique and they coach them through how to do that. It's supposed to help be calming. I already talked about cesarean delivery a little bit, C-sections, but just in case you didn't know what it was, a C-section is a surgical procedure in which an incision is made in the mother's abdomen, and then they take the baby out that way. Reasons for cesarean delivery include failure to progress through labor, fetal distress, and the baby's position. So if the baby is upside down or something like that, then they might opt for a C-section. And again, I would really recommend watching the videos on Blackboard about this. There are other methods of childbirth out there. There's some more discussed in your book, and you have an assignment about this as well. So you could go ahead and pause here and do that assignment and then watch the rest of the lecture later. So after the baby is born, then you have different measures to determine their health and responsiveness. So you may have heard of some of these before, especially if you're in a nursing field. Um, the first one is called the APGAR scale. This is widely used to determine an infant's immediate health status after birth and evaluates the infant's heart rate, respiratory effort, muscle tone, body color, and reflex irritability. So again, this is done right after birth. I have a link to a video of it in Blackboard that you can watch. Low APGAR scores have been linked to higher risk of developing ADHD. So what the infant scores on this can be really important. Even so, right after birth, this is important. The other ones, we have the Brazelton National Behavioral Assessment Scale. This one assesses the newborn's neurological development, their reflexes and reactions to people. And this one is performed within 24 hours to 36 hours after birth. So APGAR is right after they're born, and then you might have the NBAS within 24 hours to 36 hours after birth. This one is also used as a sensitive index of neurological competence up to a month after birth. So they might take this one more than once after being born. Low scores on this one indicate brain damage or stress on the brain that can heal over time. Lastly, we have the Neonatal Intensive Care Unit Network Neurobehavioral Scale. This one provides more comprehensive analysis of the newborn's behavior, neurological and stress responses, and regulatory capacities for at-risk infants. So you see how it's called neonatal intensive care. These are typically going to be done on infants that were preterm, they were born too early, that may have shown really negative results on the APGAR or Brazelton scales. So this is a more comprehensive one for at-risk infants. Lastly, I just wanted to talk about the postpartum period. I don't think this part, I don't remember if this is in your textbook or not. I can't remember if it's lifespan or child. But anyways, we're going to talk briefly about the postpartum period, which is the period after birth when the woman adjusts both physically and psychologically to the process of childbearing. This period lasts about 6 weeks. The father or partner that did not bear the child also has to adjust, and they may have to learn how to care for their new baby and their partner in this new period of their life. So the physical adjustments, new mothers will likely feel tired and need rest in the days after giving birth. This is normal, but it can lead to some new mothers feeling like they are not competent enough to take care of their baby. Another concern is loss of sleep and poor sleep quality, which can lead to stress, relationship conflict, and impaired judgment. It's estimated that the primary caregiver for the newborn loses as much as 700 hours of sleep in the first year. If the mother was exercising during pregnancy, exercise may help her physically and emotionally during this postpartum period. Emotional and psychological adjustments. Emotional fluctuations are common in the postpartum period. 70% of new mothers experience baby blues about 2 to 3 days after birth. They begin to feel depressed, anxious, and upset. These may come and go for several weeks after birth. So that's pretty normal for most new mothers. But postpartum depression is going to be different. You may have heard of this before. So this is more serious than the baby blues. So this postpartum depression involves a major depressive episode that typically occurs 4 weeks after delivery. Most women with postpartum depression do not seek help. Risk factors include history of depression, a stressful pregnancy or delivery, and lack of support. Children of mothers or fathers that develop postpartum depression are more likely to have lower levels of intelligence and poor language development. Again, because like we talked about, they're probably not getting the attention that they need in the first year of life. So your assignment for this part is going to be over the Andrea Yates case. I have a video linked on the assignment that goes more in depth into the case. So I'm not going to talk about it here very much. But this was a very publicized case. You may have heard about it already. But she was diagnosed with postpartum psychosis, I believe. Um, and well, okay, so what she did, this was in 2001. So Andrea Yates, she admitted to drowning in her bathtub her 5 children, ages 6 months to 7 years, before calling the police and her husband to their home. She had a previous history of postpartum depression and psychosis, including a suicide attempt in June 1999 that occurred after the birth of her fourth child. So this wasn't anything new. And again, this would be a big risk factor if she had it before. Although her husband claimed that Andrea appeared to make a full recovery, she experienced about another bout of postpartum depression after the birth of their fifth child in November 2000. This prompted them both to make a decision to hold off on having any more children, which obviously it was too late. So there are 3 types of postpartum depression that women can have after giving birth. Um, as Sandrock notes, the symptoms of the baby blues usually occur 2 to 3 days after birth of a baby and subside within a few weeks. A new mother experiencing the baby blues can have sudden mood swings, cry for no apparent reason, and feel impatient, irritable, restless, anxious, lonely, and sad. The baby blues do not usually require treatment from a healthcare provider. Often joining a group of new moms or talking with other moms helps. So with postpartum depression, this affects 10 to 14% of new mothers. These are similar to the baby blues, but are experienced more intensely. Um, Women with postpartum depression, this interferes with the mother's ability to function and is signs she needs to see our healthcare provider right away. Left untreated, postpartum depression symptoms can worsen and last for as long as a year. As noted in the text, several treatments are available for postpartum depression, including cognitive therapy, estrogen therapy, and antidepressants. And then lastly, we have postpartum psychosis, which is a very serious mental illness that can appear within the first 3 months after childbirth. Women afflicted with postpartum psychosis can experience auditory hallucinations, which means that they're hearing things that aren't actually happening, like a person talking, and delusions, holding untrue beliefs about reality that persist in spite of counter evidence. Other symptoms associated with postpartum psychosis include insomnia, feeling unsettled and angry, and a sense of being disconnected from reality. Individuals experiencing the symptoms of postpartum psychosis are at risk for hurting themselves or someone else, and so require immediate treatment and almost always need medication. So Andrea Yates was diagnosed with postpartum psychosis after the birth of her fourth child, although she had experienced delusional episodes ever since her first child was born. Family members and friends somehow missed or ignored warning signals, which included severely depressed states of mind, delusions, unresponsive behaviors toward her children, hallucinations, and a suicide attempt. So you can watch that video on her case and fill out the assignment for that. Just a little bit more that I don't think they talk about in the video. She does plead guilty, or I'm sorry, I think not guilty for the reason of insanity. Yeah, she pleaded not guilty by reason of insanity. Um, but the jurors in her case deliberated for 3 hours and 40 minutes and did end up finding her guilty of murder. But they spared her life and just gave her a sentence of life in prison instead of the death penalty. But soon after that verdict was reached, controversy began to stir about the culpability of her husband, Russell Yates, in the tragic event. The Gates had apparently been very influenced by a preacher and his wife who lived in a bus. They homeschooled their children and believed that all women are witches. Um, until Andrea attempted suicide after the birth of her fourth son in 1999, the Yates had also lived in a converted bus. Russell, who had been quoted as saying that he and Andrea wanted to live a simple traditional life and that they wanted to avoid social integration, then moved the family into a house and they decided that Andrea should homeschool their children. The preacher believed that society damages children and that by the time a child is 14 or 15, it's too late to undo the damage. Russell referred to these beliefs in his courtroom explanation of his wife's killing for their young children as, quote, it seems it might keep them from following the Lord long term. So I wanted to read that to you just so you have an idea of what their life was like as well, because I don't think that's discussed in the video. But they were very isolated and inundated in some strange beliefs. But they didn't really have friends or family around. So that might come into play when you answer some of the questions on that as well. But that is the end of this lecture, so you can go ahead and move on to that assignment now.